Hey, thanks for joining us on Physical Therapy M&A Talk, where I like to try to break down the strategies that make PT clinics successful in today's competitive market while also exploring leadership principles that drive growth and innovation in those practices. I'm Tanny Crawford, Director of Business Development with Martin Healthcare Advisors. Today, I've got my buddy, Josh Myers, and we're going to dive into a really important topic for physical therapy clinic owners, how to keep your clinic running like a well-oiled machine. And so Josh Myers is Director of Consulting at Martin Healthcare Advisors. He brings years of experience. Josh is a PT as well, brings years of experience helping PT clinics boost their efficiency, culture, profitability. Josh, thank you for hanging out with me just a few minutes today.
You're welcome. I'm glad to be here. This is good.
We joke, we talk about this all the time. There's only a few, like what I call unicorn PTs, who really stay on top of their metrics. Most of them are busy treating patients, double checking notes, getting the bike fixed when the bike's not operating. There's a tear in the mat leather, and so they have to, figure out how to get that tear fixed. That's what we call like working in the business, right? Treating patients, checking range of motion. So a lot of the owners get lost working in the business instead of on the business. And it's kind of like you're always running on a treadmill, but never take a step back to see where you're going. I was talking to a friend of mine the other day, the plumbing company, and he said they spend at least one Saturday a month working on their plumbing trucks, changing oil, rotating tires, repairs, transmission, tire pressure. When it's time to perform on Monday morning, they can get to the job site with no issues on the trucks, right? Because they've worked on the business on that Saturday. So why do you think it's so easy for PT clinic owners to get stuck in the day-to-day working in the business and not on the business?
I think the short answer is that's what we all went to school for, right? We went to school to treat patients, not to run an EMR report and run our business well. But at the same time, I think PTs are also probably the most serving population. We want to help anybody, right? You're in front of us, we want to help you, right? So we naturally spend all of our time doing the thing, putting out the fire, attending to the need that's in front of us, right? Most of the time that's a patient. Sometimes that's a bike that needs to be fixed or a treatment table that needs to be reupholstered, right? But we spend all of our time giving to the need in front of us. And I think as business owners, PTs would be wise to schedule some time to work on their business, right? Because it's not going to just happen. It doesn't happen automatically. You've got to be really intentional about making that time happen and show up in your schedule. Otherwise, it just gets away from you and there's another patient to treat. There's another bike to fix. Yeah.
You said something there. We're kind of helpers by nature. I think even when we're like maybe an undergrad thinking, what do I want to do with my life? And you kind of innately know that you're a helper at that point. And then you start looking at the helper categories, medical school, nursing, physical therapy, whatever, helping. That's a great point. And another thing is that running a PT clinic comes with key metrics that every CEO should know. Some of them probably, well, from my experience, a lot of them get like this analysis paralysis thing where there's so many to keep up with. And we were kind of joking the other day that you love spreadsheets, you love numbers. You could give Paul, that other interview was the other day, you could give somebody 50 metrics to follow. I think you dream in Excel sometimes. If these clinic owners had half your skill with the numbers, they'd have all their metrics dialed in already. So that's kind of why I wanted to put this out there to help a little bit.